Okay, so let's learn how to use Kasper's treatment plan feature. So in Kasper, I'm going to go to communication, and this is Tracy treatment. She is my patient that I'll be using as an example. So in her patient profile, you're going to see this little treatment plan icon here. There is a signed and a not signed section, and these are going to sync from the saved treatment plans that are created in Open Dental. So we'll go to Open Dental, and I'm going to go to Tracy treatment, and I'll go to her chart, and you can see her like completed treatment, her proposed treatment. So now I can go to the treatment plan tab, and in the treatment plan tab you can see the signed section. X is going to mean signed. And this is an older treatment plan that's already been done. And then you can see that I created a treatment plan here. For this to work, it needs to be an active treatment plan. So you can see active, inactive, saved. So you can select the proposed treatment. You can prioritize it however you like. If you're in like an inactive treatment plan, you can switch it to active. So you can do it that way as well. So prioritize it however you like, and then you're going to save the treatment plan. So I'm going to name this one root canal and crown, right? And then the treatment plan, so now it's saved, and that treatment plan is going to go to Kasper. So we'll go to Kasper, and it takes about, 30, 60 seconds or so. So you can refresh it and go back to that patient here and go to treatment plans. So it's going to appear here in the not signed section. So make sure that it's a saved treatment plan. That's what's going to sync there. So now let's review how you can present or send the treatment plan to the patient. So the treatment plan is going to appear here. You're going to click the little 3 dots here, and you've got a few options. You can send it via email or text message, or you can generate a QR code. This is for in-office tablet use. So when you select it, you will scan the QR code with your tablet, and it is going to bring up a treatment plan on the tablet in a browser, not in an app. So make sure that you're already signed into Kasper in your web browser, your default web browser in your tablet. We recommend setting your default browser to Chrome, but it's going to work in Safari, Chrome, Edge, whatever works. Any browser works fine. So that's what the QR code is for. It's for tablet presentation. And then you also have the option to open in a new tab. So this is going to open a new tab, right? And this is a way that you can present the treatment plan to the patient, and they can even sign it like using the mouse. So right now you see like a fee and the you pay section, but if there's insurance or discounts added to this patient in Open Dental, those fees are going to appear here as well. I just don't have an insurance plan for Tracy treatment here. She's a cash patient, right? So I've presented this treatment plan to Tracy, but she's going to go home, think about it. So now I'm going to send it to her via text message, and she can sign it later when she gets home. So I'm going to click this. I'm going to send it via SMS, and it's going to send her this text with a link. So texts and emails are sent securely. So I'm going to show you how it looks. So I'm going to copy this, hit copy, and then I'll open up a new tab. And then because it's secure, it wants to confirm her text or email address. So I'm going to enter that. I'm going to confirm my number. and then I'll send it. And then it's going to send that security code, the one-time password. So now I'll copy this. And submit, and that's going to let me log in. Now that I can review my treatment plan, I can, or she can review her treatment plan on her device, and then she can sign it. So I'm going to say, I'm going to sign it. And now once that treatment plan is signed, it's going to move to the signed section in Kasper, right? So it's going to move over here. And then it is also going to mark that treatment plan as signed in Open Dental. So you can see it's marked as signed. And it's also going to upload a PDF copy into the imaging folder in treatment plans. After, it takes about 30 seconds to a minute, you'll see that it's going to go into the folder at the top first. Usually that's credit approval. Give it another minute and it's going to filter into the treatment plans folder. So it kind of like goes in the top folder and then it kind of filters in through. So that is how the treatment plan feature works. I'll refresh here so you can see it move over to signed. And now you can send treatment plans to patients securely and they can sign it, and you can do it all digitally and paperless. All right, thanks, bye.